previous protocol. Thank you, Andy, for volunteering the word brachialis.
Oh.
Other side. Okay, so step 2 says gently grasp, knead, and pluck around the joint. That depends on the extent of the injury. If it's very acute and the person is experiencing pain without you doing anything, gently makes sense. If they are, for instance, a post-stroke victim where there's not actual pain in the arm but more immobility, I would suggest something a little more aggressive. Does that make sense? So we want to meet them where they're at, basically. Is this okay? So you wouldn't necessarily start with plucking, but you can. Grasping, as you know, is pulling up and releasing quickly. Do it all the way down the arm. Kneading can even be a two-handed kind of thing. It's basically just giving nice compressions and twisting just a little bit. Okay? Or whatever occurs to you. This is also possible. So this is all sort of a preliminary to start things moving, make some more plucking. Just keep your shoulder loose. Okay, so we get it all the way down to the wrist. That's the idea. Again, ideal if you bring redness to the surface, which is known as sha in Chinese. Okay, then traction. Hold it. Traction and separate the wrist. That's all that means. You can do it several times. Just do it slowly, please. All of these things should just have a nice, easy pacing. Okay. Range of motion. So we're going to do the elbow first, and then we're going to do the thumb with the same thing. And as I do this, why don't you think about why we're bothering to do the thumb as well. Simple rotation. Flex, extend. And then do the same thing with the thumb. So before I get into getting answers from you why we're doing the thumb, make sure you're going for the big joint of the thumb here. So we're not just like rotating these metacarpals over here. That's not so helpful. We're really actually trying to grasp the big muscle and move that. Okay. Both directions. Gently flex. Gently extend. So why the thumb?
Open up the channel.
Sure. It's one reason, although many channels run through the elbow. 6 of them, actually.
Blackberry don't texting a lot.
This is true, but we're treating the elbow.
It's where it attaches, or one of the muscles attaches into the thumb, and its origins in the elbow.
That's also possible, sure. Pretty sure. But doesn't the elbow involve the ulna as well? Think a little more big picture. Think if the word holographic means something to you, which is sometimes where we use one part of the body as a sort of alternate image of another part of the body.
Could be a mirror image from your elbow. Like a reflexology. Yeah.
Kind of like that, but closer to what Lena's saying, actually. So it's not exactly a mirror image, but you're on the right track. It is a sort of image, in a way, right? It is a kind of microcosm of the elbow itself. So does it have the same range of motion as the elbow? Well, actually it has more, in a way. It's a different kind of joint. In a way, it's actually more akin to the shoulder. Okay. But in this case, in Chinese medicine, you can very often take some large joint and find a parallel elsewhere. So I would say for that reason, the little finger is a little less effective as a mirror image. Okay, but this, also I've seen a lot when people have some kind of elbow issue, their thumb is sort of rigid or bent out or something, or there's going to be pain in there as well. So this might actually involve a little digging into the big thenar eminence. Is that okay? Does that all make sense? Okay. Okay, hold elbow and rotate wrist. People always read these instructions and they have no idea what I'm talking about. So it's simply this, you're holding it two places, right? One, I'm stabilizing here and moving the elbow like this. The other, I stabilize here and move the wrist like this. It's just doing the same thing from two different directions. That's the whole idea there. Okay, then we get along to this famous scrubbing and chafing. So yes, it is true the yang channels of the arm do move from the fingertip up towards the head. But in this case, I'm using a more basic conception of stagnation where something is stuck. I want to get it out the closest place that I can. So if it's somewhere on the leg, I want to get it out the toes. If it's somewhere on the chest, I want to get it out through the fingers. That's the basic idea. And also remember with a lot of these shoulder protocols, even when we're doing this kind of thing, we're moving from medial outwards lateral. Very basic principle. Okay. Lots of nice scrubbing. Is that too much? Maybe I'm not doing it hard enough. Stop. You can also add to this, I know it's not written in. It's too uncomfortable to handle, there are too many bones to do the same scrubbing and chafing, but you can here add in a nice pluck at the end of each of the metacarpals to just help the evil chi continue its journey out the body. Okay. Finally, we're pressing and round rubbing LI4 and LI11. LI4 is the famous point where we have to ask about pregnancy. Are you pregnant or trying to get pregnant?
No.
Okay. So that plus you all remember where LI11 is. So I'm just trying to make a connection here. I'm not so concerned with moving the energy one way or the other. Okay, so pretty simple protocol, right? Can you all pair up?